Hello and welcome to Senior Speak New Hampshire on your Concord TV, sponsored by AARP. I am Karen Almer-Dorsch, the producer host of this program, and I want to wish all of you a very safe and healthy new year. And I thank you for being with us today. If you are regularly with us, you know that AARP's focus is the health, wealth, and self of our 50-plus population. And I thought it would be most appropriate to begin 2022 with a program and a guest that offers that covers all of these areas. Recently, Concord Regional Visiting Nurse Association and Central New Hampshire Visiting Nurse Association united into an agency that is Granite VNA. Last autumn, I had the good fortune to connect with Jennifer Brechtel. Ooh, I was worried about that name.
You did very well.
The Community Benefit Manager of this organization, and to learn about Granite VNA. I knew immediately after listening to Jen, she was going to be my January guest for this program. So, as a community benefit manager, Jen plans, develops, and oversees the agency's community benefit programs, activities, and staff. She is involved in broader, collaborative initiatives with community health, home health, and hospice throughout the agency. She received a bachelor's degree in health education, wellness management from Plymouth State University. And she's a certified health education specialist who facilitates many of the Granite VNA wellness programs, including the Aging Mastery Program, a matter of balance, better choices, better health, and powerful tools for caregivers. All of the programs that you'll be hearing more about this evening. And it is therefore my extreme pleasure to introduce you to Jen, who has a great message to share with you today of many free programs available to you through Granite VNA. So Jen, thank you so much for being with me today, and please take us away telling us more about Granite VNA.
Sure, thanks Karen. It's a pleasure to be here. Thank you for the invite. So just like you said, Granite VNA is the joint entity of the Concord Regional VNA and Central New Hampshire VNA and Hospice. So in April of this year, we became one organization. So together we service 82 towns in the Capital and the Lakes region. We are a traditional home care and hospice provider, so we do primarily see people in their homes. We also own and operate the Hospice House on the Concord Hospital campus, but we are a community-based, not-for-profit, really focused on providing care to people in all stages of life.
Wow, that's wonderful. I did not know you had the hospice home at the hospital.
We do, yep. So it was original to Concord Regional VNA, so when we became one entity, it became Granite VNA. So we're very fortunate. It was actually the first hospice house opened in the state of New Hampshire.
Wow. Well, it's a wonderful place.
It is a nice place.
Okay. Can you talk more about the programs and the services that you provide?
Sure. So I would be remiss if I didn't start with kind of our flagship programs, as I like to call them, which is home care and hospice. So we really look to support people in their home, providing medical care to those who might require what we call skilled services. So it might be when someone's discharged from the hospital, our nursing or our therapy staff might go out to help them rehab and get back on their feet. We might also, if someone's experiencing complications with a chronic illness, or maybe they're challenged in managing their medications, we might also be able to go out to provide care to them. Everything we do under home care and hospice is ordered by someone's physician, and then that physician oversees their care. So our staff is kind of the boots on the ground, the boots in the home, providing care and support to those individuals. And we also provide hospice services, which really is care provided to individuals who are facing life-limiting illnesses. Again, that care is directed by their primary care or their physician, maybe not necessarily their primary care. But when we think about hospice, it really is about comfort and care at end of life. So along with our nursing and our therapies, we also have spiritual care and social work who supports our hospice patients. And then we also provide some non-medical in-home care, which really are those services that don't require a skilled nurse or a therapist, but really are those services that are still important for people to be able to access to maintain their independence. So really thinking about things like light housekeeping, laundry, meal prep, errands of necessity. And the last thing, and what's most near and dear to my heart, is what we do under what is called community benefit. And those are community-based services that we provide at no charge to the community, really focused on enhancing the health and the independence of individuals who are aging throughout the 82 towns that we service.
Okay, so let's talk a little bit about that community-based program. How would someone connect for that?
Sure, so there's lots of different ways people can connect to our community-based services. They can certainly call our agency. Our phone number is 603-224-4093.
And won't we have that on later?
Yes, you'll have that. You'll also have our 800 number in case people live a little bit further outside of Concord. It'll also have our website. And so if you call our agency and just say you're looking for more information on community benefits, you will get in touch with either myself or my coworker, Katie, who is just as well versed in supporting people accessing our services.
Okay, and let's say that I am someone who, I'm not facing terminal illness yet, but can I have hospice care?
So the way hospice...
How does that work?
Yeah, so the way hospice works is it is really indicated for people who have a life expectancy of 6 months or less, and that's as certified by their physician. So that's not to say that if someone is diagnosed with a terminal illness and they live longer than 6 months, that's a good thing. That's okay. We can still provide hospice care to them, but it's constantly evaluating where they're at. But again, it's all ordered by their physician. And the nice thing about hospice is it can be provided wherever someone calls home. So we do hospice in homes. We might go to a long-term care facility or an assisted living or the hospice house.
Okay, and can people start hospice and then stop and come back to it?
Yeah. Yep.
Okay,
So
that's a possibility.
That is a possibility, yep. So if someone elects to use their hospice benefit and then something changes, I always say the human spirit is a pretty amazing thing, and things certainly can change. So if someone decides or maybe improves in their condition, they certainly can come off of their hospice benefit, and then over time, if they want to re-elect to come, they certainly can do that. So it's very fluid.
I'm glad you said that, because I have a lot of people that I have talked with who think that you have to be dying before you can access hospice. And I thought that was not accurate.
Right, yeah, so it really is focused on that kind of the guideline around 6 months or less. And we always say, it's really important for people to come on hospice sooner rather than later. A lot of times we see people who elect hospice as a benefit kind of as they're in their final weeks or their final days. But if someone is able to and willing to elect their hospice benefit sooner, it really does allow our hospice team to do what they do best, and that's really kind of, again, give that quality of life at end of life.
Right, okay. So can you talk a little bit more about Granite State, how they began offering the community-based service and education?
Sure. So the community benefit programs that we offer originated with the Concord Regional VNA. And so back in 2012, 2013, we were doing some things to support those aging in our community. But really, kind of at that time, the CEO and the Board of Trustees took a step back and said, what else can we do? How else do we support people who are aging in their community? Because we were doing a great job with home care and hospice, but we knew not everybody might need those services,
Right.
but people were aging. So we spent a lot of time talking to community partners and individuals who were aging in the community, to find out what really did they need, what really did they want. And then once we were able to gather that information, we spent a lot of time researching what types of programs we could do that would best support those individuals. So it was a pretty intense process. And I think we're going to look at doing it again as we start to move our programs into the Lakes region, because it is relatively new in that area. And we appreciate what worked really well in the Capital region might translate a little bit differently to the Lakes region, and we don't want to try and put that square peg in a round hole.
Right.
We really want to meet the community's needs.
Right. Okay. So with an aging population of New Hampshire growing and changing, can you share with us some of the specific educational programs that you offer to assist people aging in place?
Sure. So some of the stuff that we do some evidence-based programs, which are nationally recognized programs that we have sent our staff to be trained in to facilitate in the communities. As you can imagine, when we started talking to people who were aging in the community, a lot of people started to talk to us about fall and fall risk. And it was really important for us to find a program that would help support those individuals specifically. So we do offer a Matter of Balance, which is a fall risk reduction program focused on adults over the age of 60. But that's not to say if we have someone maybe in their 50s who is challenged or concerned about falls that we would allow them to participate. And what a Matter of Balance does is it really does focus on helping people overcome any thoughts or fears or concerns around falling, because we know the fear of falling is a risk factor for falls, but it also provides them physical activity, or hopefully increases people's exercise as a result. So for a Matter of Balance, it's not an exercise program, but in the third week, we start to do exercises that are very focused on strength, balance, flexibility, endurance, and strength, I think I didn't say. And what those do is they are exercises that individuals can do and then carry them forward to really help reduce their risk of experiencing a fall.
So Jen, are these classes or?
Yes.
They're classes.
They are classes, and each one of them differs a little bit as far as how long they last and how much time is committed to them. For a Matter of Balance, it is an 8-week fall risk reduction program. We offer it at Granite VNA, but it's offered by different organizations throughout the state. So if people maybe don't live in the 82 towns that we service, it's one of those programs that a lot of different organizations in our state are offering.
Okay, so are they Zoom now, or are they in person, or what's the deal?
So it depends on a couple of different factors. We are doing a lot via Zoom right now. So we are doing a Matter of Balance via Zoom. We are doing some in-person classes, but it really is about space and making sure that the space would be large enough to accommodate 8 to 12 people, 6 feet apart, and using masks. So
Okay, so let's say that I belong to an organization that is interested in this particular class. What is my obligation as an agency to get that going in my community?
So depending on what community you're in, if you are someone who is in one of the 82 towns that we service, you can reach out to me, and we can certainly have a conversation about how do we make that happen and how do we get it to come to your community. And you know, we're very fortunate. We've got some paid staff who's trained to facilitate the program, but we also use our agency volunteers, which is a nice kind of feature to be able to have that deep of a bench to support this program.
Okay, so we would just contact you and say we're interested in having this program here, and then we would provide a space and you take care of the rest. Is that right?
Exactly. So for anything we do in community benefit, it is out in the communities that we service. So we are consistently partnering with churches and senior centers and community centers and community groups and libraries to bring these programs to where people live, because we appreciate it might be hard for someone to get to Concord or to Laconia or to Wolfboro where our offices are. So we want to make sure we are out in the Hillsboroughs or the Wolfboro, or the Wolfboroughs or the
Right,
Moulton Boroughs
wherever.
or wherever it
Uh-huh.
may be.
And these people are aware of you. Is that correct? I mean, the community center, I mean, the senior centers and these various peoples, they're aware of.
I would like to say yes
I
to
hope
that
so.
question. If not, hopefully they are now.
Yes.
But we do spend quite a bit of time kind of trying to make those connections in the outreach
All right.
and really count on other partners we have in the community if they know of a need or if we're able to service someone to kind of making that connection to us.
Okay, great. All right. So let's see where we are now. Can you, let's see, there's also been a mention of community-based health clinics. Can you elaborate on those services?
Sure. So we do a couple of different types of clinics. We do an immunization clinic at St. Paul's Church here in Concord, really focused on those people who are uninsured or underinsured so they can have access to immunizations. We do blood pressure clinics throughout our service area. When seasonal flu rolls around, we do quite a bit of public and private clinics to make sure people are able to get vaccinated against seasonal flu. And we also do quite a bit of foot care clinics throughout our service area. So these are really places where people can go and see one of our specially trained registered nurses to receive very basic foot care. So they're going to clip and file toenails. They're going to kind of do an overall assessment of an individual's foot and then kind of provide lotion and massage and make sure that feet are well taken care of, because we know as we get older it's sometimes a little bit harder to do those things.
Right, it is. Okay, so then let's talk about the aging population in New Hampshire. And I start to think about family caregivers and the value they bring to the community. And what are some of the specific things that Granite VNA does to support some of the 170,000 caregivers in our state?
Yeah, so as an organization, Caregivers was another group that kind of bubbled to the top of need as we think about aging population. So we do what we call a Caregiver Connection Group, which is an online support group. We do it traditionally, I think, on the fourth Wednesday of every month at 10 o'clock in the morning. And that's just a place people can come in virtually to connect with other caregivers. It's facilitated by one of our master level social workers. And again, it's about resource, but it's more about connection with other people who might be experiencing similar challenges or even opportunities. We also do another class called Powerful Tools for Caregivers. And this is a caregiver educational program. Although, as you can imagine, when you get a group of family caregivers together for a class, organically they tend to support each other. But this is a 6-week class that really focuses on providing family caregivers the tools and the resources they need to take care of themselves in their role as a caregiver, because we know family caregivers give their all to their care partner and sometimes don't take such great care of themselves.
And viewers, I am currently enrolled in that class, and it is absolutely fabulous. The kinds of things that I have learned. I'm currently not a caregiver, but because I knew Jen and I knew there was this class, I wanted to audit it to see what it was like. It is absolutely wonderful. And the booklet that comes with it is just such a wonderful resource. I am really enjoying this experience.
Nice.
Yep,
Nice
I really
hear.
am. And I am convinced that if every class that they offer is like this one, you will have such a wealth of resources available to you for being someone who can comfortably age healthily in place. Yes. Okay. So as a hospice provider, are there specific community opportunities offered to help, I think I'm reading this right, to help information and foster conversation around end of life?
Yeah, so that's a heavy topic that not a lot of people maybe want to engage in, but having conversations about end of life is an important part of living, right? Making sure our loved ones know what our needs and our wishes are when we are faced with a life-limiting illness. So we do quite a bit of community-based education around advanced care planning So we might provide education to individuals on how to complete their advanced care documents, so their living wills and their durable power of attorney for healthcare. We also offer what we call Walk-In Wednesday, which right now the name is a little misleading because it's not walk-in, but it is virtual. And that just provides people an opportunity to, again, connect with one of our social workers to go through the advanced care planning document and have their questions answered. Because if you've ever looked at the document, it really can sometimes feel overwhelming and confusing. So having someone who really is well-versed and trained in that and just taking you through and answering your questions is really important. So again, it's not walk-in right now, it is virtual, but people can certainly give our office a call, and we're happy to schedule appointments with one of our social workers to get questions answered, and also to kind of steer people in how do you get them notarized, or what's the process for them being witnessed at this point. And the other thing that we do that is also currently on hold is we call it a Dying to Talk cafe. It's kind of known in other areas of the state and globally as death cafes. And really, this is just that opportunity for people to come together in a casual setting, have some tea, have some coffee, have some cake, and talk about death and dying, which, again, it's really getting people to understand that these are important conversations that we should be having on a regular basis. And also for people to ask questions. I think everybody's curious about death and dying and what happens, and not that those questions can be answered, but sometimes if you're at least able to have a conversation with people who are thinking or feeling the same thing, it provides a little bit more perspective and maybe even a little bit more reassurance.
Yeah, I've always felt I don't like surprises. I don't like surprises at all. So I want to be ready, and I want to know what to expect for everything. And so I've done an awfully lot of reading about death. And the thing that I think that is so interesting is that it's such a taboo topic in our in our society, when it should be just a normal process in life. I mean, this is going to happen. It happens to all of us.
Right.
And to know how to prepare for it, and to be willing to accept it, and to live fully up until that moment, I think is just really something that is missing when we don't want to discuss that.
Right.
Yeah.
And so we spend a lot of time doing education around the conversation piece of it, and how do you have that conversation with parents or adult children or siblings or whoever the loved one is who doesn't want to talk about it? How do you kind of approach a topic that's so important but so taboo at the same time, and realize that all of us are going to be faced with death, and so the more we can be prepared and the more our loved ones know what we want, we're actually giving them a gift or doing them a favor by sharing with them what our wishes are, because then they don't have to guess when we're not here.
And also, not just that, but I think it's important to talk to the very young. For us who are aging and who are going to be disappearing before very long, it's so important to prepare those young people for that time.
Right.
And so I'm really happy to know that you have that particular program that's available.
Absolutely. And and we also do your traditional grief and bereavement support groups for the community. So someone does not have to have passed away on our hospice service to participate in those. We do support our bereaved hospice families, but we also want to make sure that community members are supported, maybe whose loved ones didn't pass away on hospice. So we do quite a bit of grief and loss groups, and even as holidays approach or other Veterans Day, Mother's Day, Father's Day, making sure there's opportunity for people to be supported as they grieve the loss of a loved one, because no matter how long it's been since a loved one's passed away, there are those milestone dates that can really still emotionally be challenging for us.
Okay, and as I told our viewers, our focus is health, wealth, and self. What is there that you do with helping people with, let's say, wealth or finances?
So we don't dip too much into the financial piece of it. I will say, and I maybe should have mentioned this when we talked about some of our community education, we offer what's called the Aging Mastery Program.
Yes,
which
let's talk about that.
Yes, so which is from the National Council on Aging. It is a 10-week wellness class for people who are aging in the community. So it's really focused on those people who are nearing or at retirement age.
Yeah.
But I will tell you, we have had people in their 80s and 90s participate in this class who walk away with just as much information. And what makes the Aging Mastery Program really cool, or at least I think, is it gives people access to subject matter experts in different areas of aging well. So unlike our other programs, which are still great, but they're facilitated by our staff or by our volunteers, for the Aging Mastery Program, we invite professionals in to facilitate a conversation with people. And so again, that talks about some things that are a little bit different for us for an agency. So we do work around financial fitness with that. So we've partnered with Merrimack County Savings Bank in the past, New Hampshire Federal Credit Union in the past, to have one of their experts come in and just talk to people about how do you manage your finances as you age and really plan for your retirement and kind of the golden years, if you will. We also have the Sleep Center come in, so we typically partner with Concord Hospital to talk about sleep and aging, and then nutrition, so healthy eating and hydration, healthy relationships, but it really looks at the kind of overall health and wellness for people, which is great.
That's absolutely wonderful. People, these programs are out there for you, and I hope that after you have heard what Jen has told you, you will connect with her and her agency. And also that you will tell viewers who are not within the range of this particular program. I know they can access this on their Concord TV on demand on their computer if they would like to. So this is an outreach that you can provide for people who are about to retire or younger, or even those of us who are retired. So Jen, it has been wonderful again to hear about these wonderful programs that you have. And I do hope that you will connect with her and her Granite VNA for any of the help that you have available to you. That is also most of it is free. And we do have the area. We have I think a post up of the area that this particular VNA services. So until next time, be good, do good, be one.